Now, while it's well known that hot flashes, heart palpitations and difficulty sleeping are all physical symptoms of the menopause, many people don't realise the toll that hormonal changes can take on
And this whole lack of sleep is really real. What it does to your brain. I have flooded my laundry room 3 times because I go in there and I forget why I went in there. I turn the water on, I heat up the dog food, walk out, get busy, and then I hear bop, bop, bop. My alarm has gone up and there's like 3 feet of water in my laundry. Like 3 times I've done it. 3 times. And I would have never done that before this stage of life.
Brain fog is real.
The brain fog is so real. When you don't sleep, then you're aggro, and you forget things, I'm fighting with everybody. It's crazy.
For me was mood. Your mood, this can render you absolutely powerless. And the reason why is because it doesn't just affect you, but it affects the people around you. And so it's the one symptom that actually affects others. And so, I'm constantly asking my family for grace all the time because I will say things that, I'm like, did I just really say that? And so it leaves you feeling powerless.
Are you struggling with restless nights, waking up for no reason, snapping at things that never used to bother you, or forgetting names or little details? If this sounds familiar, you're not alone. These are common signs of menopause or perimenopause, the stage leading up to it. In this video, we'll break down what's really going on in your body and how hormonal changes can affect your sleep, mood, and memory. But that's not all. We'll guide you step by step through each change. So by the end of this video, you'll not only understand what's happening in your body, you'll also know how to take control of your symptoms and start feeling like yourself again. Now, let's begin with how menopause affects your sleep. Our mothers and grandmothers called it the change of life. They expected it, but few talked about how menopause can quietly steal your sleep. Sleep struggles are one of the most frustrating and overlooked symptoms of menopause. They often begin in perimenopause and can linger for years after your last period. Research shows menopause disrupts sleep, leading to frequent wake-ups and trouble staying asleep. It can drain your energy, strain relationships, and make it hard to focus. The culprit? Shifting hormones, especially a drop in estrogen. A major NIH study confirms that during menopause, estrogen and progesterone levels fall sharply. These changes are behind many symptoms, including sleep issues, and they can last 2 to 8 years, though timing varies. Estrogen helps regulate sleep, so when it drops, falling and staying asleep gets harder. Even deep sleepers may wake up frequently. Hot flashes and night sweats are the biggest disruptors. Triggered by low estrogen, they can jolt you awake, sometimes even before you feel the heat. Studies show many women wake just before a hot flash hits, making restful sleep even harder. Hormonal changes can also increase snoring and the risk of sleep apnea, where breathing stops and starts through the night. It often goes undiagnosed in women, who may just feel drained and blame stress. Insomnia is common too. Trouble falling asleep, staying asleep, or both. And let's not forget restless leg syndrome, RLS, which causes strange sensations that make it hard to relax or drift off. When these symptoms pile up, you can feel exhausted and irritable, even after lying in bed all night. And poor sleep only worsens mood swings and memory issues. The good news, you can reclaim your rest. Here are some simple, practical tips to help you sleep better starting tonight. Number 1, keep your bedroom cool and comfortable. Hot flashes and night sweats are less disruptive in a cool environment, so use fans and breathable bedding and wear moisture-wicking sleepwear to stay comfortable throughout the night. Number 2, stick to a sleep schedule. Go to bed and wake up at the same time every day, even on weekends. This trains your brain to follow a steady rhythm, making it easier to fall asleep and stay asleep. Number 3, eat for a better sleep. Add foods rich in sleep-friendly nutrients like tryptophan and magnesium. Think turkey, seeds, legumes, leafy greens, and even dark chocolate. These help your body produce calming hormones like serotonin and melatonin. At the same time, avoid caffeine, heavy meals close to bedtime, and alcohol. all of which can disrupt your sleep cycle. Number 4, move your body. Regular exercise, about 150 minutes a week, can ease hot flashes and help you sleep more soundly. Just avoid intense workouts late in the evening, as they can make it harder to wind down. Number 5, evaluate your symptoms with a healthcare provider. If lifestyle changes haven't helped, it's time to talk to your healthcare provider, ideally a menopause specialist. They can evaluate your symptoms and recommend personalized treatments to get you real relief and peace of mind. Now that you know how menopause affects your sleep, let's explore the surprising ways it can impact your mood. For many women, menopause brings unexpected emotional shifts that go far beyond feeling off. Mood swings, anxiety, irritability, even depression can last for weeks or months. What makes it even tougher? These changes often surprise women who've never dealt with mood issues before. In everyday life, this might look like snapping at loved ones, feeling sad or restless for no clear reason, or losing interest in things you used to enjoy. Even minor stress can suddenly feel overwhelming. These emotional changes are real, and you are not alone. Many women have the same questions about how menopause affects mood and relationships. Even on one of Oprah Winfrey's shows, a medical expert explained how estrogen plays a key role in these shifts, highlighting just how powerful hormone changes can be on your emotional well-being.
You know, when we talk mood encompasses a lot of things. It's anxiety, sometimes it's depression, sometimes it's just mental fatigue or brain fog. And sometimes
and weariness, as we're hearing with Tricia before.
And sometimes it is irrepressible rage. You can see and hear yourself and say, now I know that should not be my response. It is inappropriate for the situation at hand. But you really, what I think is worrisome for women is that they feel out of control in that situation. But here's the connection. We think of estrogen and our reproductive hormones as just having to do with reproduction. It's only about our breasts and ovulating and being pregnant. But the reality is our reproductive hormones affect most major organ systems in our body. And what's the one that needs estrogen the most? Our brains. So the areas of our brain that really are responsible for mood, for sleep regulation, for temperature regulation, all of those areas are responsive to estrogen or lack thereof. And when you're in perimenopause, it's not so much that on any one given day you have too little estrogen. Some days you have too much. Some days you have too little. So it is the wild fluctuations that is really scrambling your brain about how to react to situations. And every woman, every perimenopausal woman I know has had that feeling where you're talking and right in the middle is just out of your head. And it's very distressing because women think, am I going crazy? Is Alzheimer's on the horizon for me? And it's just your brain trying to adjust. It's used to regular hormones in a cyclical fashion.
Well, it's why a lot of women are put on antidepressants.
Exactly. That is exactly right.
When they really need hormones.
Exactly.
Yes.
The same hormonal drop that affects your sleep, estrogen and progesterone, also impacts your mood. These hormones influence brain chemicals like serotonin and dopamine, which help you feel calm, balanced, and happy. When they fall, mood swings, anxiety, and even depression can follow. But here's the good news. You're not powerless. Menopause doesn't have to mean emotional chaos. Here are simple, effective ways to support your mental and emotional well-being during this transition. Number 1, talk to someone. Don't go through this alone. Bottling up emotions can make things worse. Talk to a trusted friend, open up to loved ones, or join a menopause support group. Sharing your experience and hearing others can bring real relief and remind you that you're not in this by yourself. Number 2, exercise and eat healthy. Exercise is a powerful mood booster. Even a 30-minute walk a few times a week can lift your spirits, ease anxiety, and help you sleep better. Physical activity releases endorphins, your body's natural stress relievers, and gives you a sense of control during a time of big changes. Number 3, avoid alcohol. It's tempting to unwind with a glass of wine after a tough day, but alcohol can backfire. It may seem calming at the moment, but it can actually worsen mood swings, increase anxiety, and disrupt sleep, making the symptoms you want to avoid even stronger. Number 4, nurture friendships. Sometimes a simple coffee date or honest chat with a friend can do more for your mood than anything else. Strong social support protects your mental health and helps you navigate stress with clarity and strength. Number 5, seek medical help. If your symptoms feel overwhelming, speaking with a mental health counselor can be truly life-changing. Therapies like cognitive behavioral therapy, CBT, and interpersonal therapy are especially effective for menopause-related anxiety, depression, and even intimacy issues. Therapy helps you manage emotions, challenge negative thoughts, and reconnect with yourself during this major life shift. Now, let's take a closer look at how menopause affects your memory and what you can do to stay sharp and focused. But before we dive in, if you're finding this video helpful, please give it a thumbs up and subscribe to our channel. Your support helps us reach more women who need this guidance during their menopause journey. Just like sleep and mood, memory can take a hit during menopause. Maybe you walk into a room and forget why, or spend minutes looking for glasses that are on your head. Sound familiar? Yep, it's the hormones again. Here's the thing. Memory issues often start before menopause fully kicks in. During perimenopause, typically from your late 40s to your early 60s, your brain starts reacting to the drop in estrogen, which plays a super important role in memory and focus. Estrogen isn't just about periods. It also powers your brain. It keeps memory sharp, supports focus, and helps brain cells communicate. So when estrogen drops, your brain scrambles to adapt, which can lead to that familiar foggy feeling. This brain fog, forgetfulness, trouble concentrating, and searching for words is real. Neuroscientist Dr. Lisa Mosconi explains in her TED Talk how menopause directly impacts brain health. According to an NIH study, women face a higher risk of age-related dementia than men, partly due to the impact of estrogen on brain health. But here's some comfort. Forgetting names or misplacing your keys is usually a normal part of aging and hormonal changes, not a sign of dementia. Still, if something feels off, don't hesitate to check in with your doctor. Now, let's focus on what you can do. Here are some practical, proven tips to help keep your memory sharp during this stage of life. Number 1, keep your brain busy. Challenge your mind on purpose. Read, learn a new skill, solve puzzles, or dive into thoughtful conversations. Activities like these keep your brain active, sharp, and more resilient to memory lapses. Number 2, maintain a healthy relationship. Don't underestimate the power of staying connected. Social interaction is more than just chit-chat. It stimulates your brain with fresh perspectives and emotional support. Number 3, eat good food. Boost your memory with a brain-friendly diet. Limit ultra-processed foods and begin to add more omega-3s like those in fish oil to your diet. Follow a Mediterranean-style approach with fruits, veggies, whole grains, and healthy fats. These superfoods support cognitive function and help manage conditions like high blood pressure or diabetes that can also impact brain health. Number 4, move with purpose. If you spend long hours sitting, like many of us do, regular exercise becomes even more important. It's not just good for your body, it's powerful brain fuel. Movement increases blood flow, supports brain cell activity, and releases feel-good hormones that boost mood, focus, and clarity. Now, here's a question many women ask. What about hormone therapy? Well, hormone therapy can be a game changer for many women, easing menopause symptoms like sleep problems, mood swings, memory lapses, hot flashes, and night sweats by restoring some of the estrogen your body is losing. The most common type is hormone replacement therapy, HRT. By helping to rebalance hormones, HRT can reduce emotional distress and improve overall well-being. But timing matters. Starting HRT during perimenopause or early menopause may support brain health and memory. However, starting it too late, especially after age 65, may increase health risks rather than provide benefits. If hormone therapy isn't an option for you, don't worry. There are other ways to support brain health. Managing blood sugar, eating well, staying active, and protecting your brain's energy systems can still make a big difference. It's also important to know that opinions on HRT vary. Some experts caution against it for women with certain medical conditions or genetic risks, like breast or ovarian cancer, stroke, or gallbladder disease. Others believe that for many women, the benefits outweigh the risks. The bottom line is this: the best choice depends on your unique health situation, so be sure to talk it over with your doctor. According to the NIH, estrogen therapy can be a sensitive topic due to potential risks. But for women with severe symptoms, it can offer real relief, especially when used in non-systemic forms. Non-systemic estrogen is applied directly to the affected area, like the vagina or urinary tract, rather than circulating through the entire body. This targeted approach can significantly improve comfort, daily function, and even sexual health with fewer risks. In fact, without this kind of treatment, about 1 in 3 women experience symptoms that interfere with their quality of life. That's why how the estrogen is delivered matters, and why it's so important to talk with your doctor. A trusted healthcare provider can help you weigh the options and choose what's safest and most effective for you. Remember, menopause isn't just a phase, it's a powerful transformation. You're becoming wiser, stronger, and more resilient. And with the right habits and tools, you can protect your memory, improve your sleep, balance your mood, and stay confident every step of the way. Thanks so much for watching. If this video brought you clarity or comfort, don't forget to give it a thumbs up and subscribe for more practical, empowering tips on navigating menopause with grace and wellness. Also, check out the video showing on your screen right now to learn the untold truth about menopause. See you there.